When you're beginning to warm up the feet, take your time and go over the surface of the feet. I like to do this initially through the blanket just to get the client used to your touch and the kind of pressure that you're going to be using. It also gives you an idea of what kind of pressure the client is going to need and what kind of tightness to expect when you start to work on the feet. When you do reflexology, you always want to start with the right foot. And in this video, we're going to be going over just some basic relaxation techniques that you can use. These can be used in between each chakra point that you are working, and they can also be used before and after the session. I like to include plenty of them just to get the client comfortable, relaxed, and to get the most out of each treatment. You can apply a little bit of oil or lotion. You don't need very much when working on the feet. I like to use just enough to soften the skin a little bit and to make it easier to do some gliding techniques when you're doing the relaxation. A good place to start is to work up the spinal reflex on the inside of the foot or the medial side. This can be done all the way from the bottom of the foot up through the top of the foot. You can work the entire area of the foot between each stroke up and between each different reflex that you're working. When you're doing general relaxation techniques, you don't have to do them in a certain order. I like to do a lot of work up at the top of the foot, by the toes, and where the toe meets the foot. Because this is the neck reflex, you'll often find that there's a lot of tension up there to work with. You'll also find as you're working the spinal reflex that there can be a lot of crunchy spots or hard spots where it feels like the client has some things built up. This is common in reflexology, and you'll find that the more you work over the area, you're generally able to break up some of those deposits and blocks that your client is experiencing. I like to do a lot of work around the heels as well and the Achilles. If your client comes in complaining of any kind of plantar fasciitis symptoms or any other tightness, stiffness, especially around the ankle, it's always a good idea to work the Achilles area as well. You'll also like to use techniques like thumb walking or finger walking, which are used in any reflexology treatment. When you're doing some relaxation techniques, you can turn the finger walking or thumb walking into longer therapeutic strokes. This is a little bit more comforting to the client, and it really helps set the mood for relaxation for your client as well. Again, working the entire surface of the foot here is really going to give your client an overall sense of relaxation, and it helps them to absorb the treatment that they're going to be receiving. You can use the thumb walking technique along the whole entire surface of the foot. Sometimes it is easier to use finger walking up around smaller areas like the toes where it's harder to get the thumb in, but you can use a combination of both when working up through the toes. It is also good to keep checking in with your client to see how the pressure is. There might be times when the client needs a little more or a little less pressure depending on the area that they're working and the sensitivity of that area. If your client is particularly sensitive or even ticklish, which some are, you want to check in and make sure that the pressure you're using is adequate for relaxation and it's not making your client uncomfortable. If you feel certain areas that are tight or feel restricted, or that your client is complaining about that they're feeling discomfort in, Feel free to spend some more time on those before moving on. Depending on how long your typical reflexology session goes, you can incorporate as many or as little of these techniques as you wish, and you can spend as much or as little time as you want between working each chakra. In the chakra video, you will also find that some of these relaxation techniques are used. This helps to give you a broader approach to how to use them and to fill the time effectively between working each chakra. Toe strokes are a great transition relaxation technique, and they also are effective at getting the client used to you touching around the toe area, which is when you're going to be working some of the chakras, you will be around the toes and the big toe where the glands are. So you want to take your time and do a thorough job both around the toes and again down by those heels, down that Achilles. Some of the strokes, like the heel slide, like you see here, are very effective for getting the client to relax and for loosening up not just the areas of the foot, but the whole leg. Most people carry a lot of tension in their lower legs, and that does extremely affect the foot and the Achilles area. So take your time when doing these techniques. When you're stroking up the foot, you can also alternate thumbs going out to each side or turn it around and come back to doing your heel slides in between each technique. It's also a good idea to get the client used to the touch around the medial malleolus area, or the inside and outside of the ankle. That's where you're going to be working on the second chakra, so it's a good idea to loosen that area up a little bit as well. You also want to focus on any areas that you're feeling a blockage already, because working these areas out first is going to help the chakra treatment be more effective once you get to that point. When you're doing the slides and some of the heel strokes, you want to always keep the foot braced. So I like to keep one hand underneath of the foot while I'm working with the other. Unless you're just doing the upper part of the foot, it's a good idea to keep some of that bracing. Not only does it help you get your correct technique and positioning, it also helps the client feel more secure. So when I go down to work on around the ankle, I like to always keep one hand down there, and that helps them know where your hands are at all times during the treatment. And it helps provide them a little bit of a sense of security and stability when you're working deeper into the foot. Another great technique to use to get your client to really relax is to hold the solar plexus reflex found where you see the right thumb in this video. You can do a couple of different things with that. You can hold and release, you can press it in. I like to hold it for a few seconds, release, go back in, and then follow up with some good ankle releases here, getting the foot completely relaxed, getting those muscles and tendons and ligaments nice and loose, preparing the client for the chakra portion of the treatment, which you will see in the other video. Again, go over any areas a few times that you feel a little extra tension or that maybe the client has complained about tightness. The arches are always a great place to spend some time because a lot of people wear improper shoes, spend a lot of time on their feet, or this is also the area that is commonly affected in a lot of conditions like plantar fasciitis. So it's good to take plenty of time and work the whole area, not just one area in particular. You can always switch hands when you're doing these techniques as well. You'll see that some of the techniques and some parts of the relaxation process, I switch between the right and left hand on the bottom. This can be done to help you with positioning or to just give one hand a little relief at a time. Anytime that I'm applying deeper pressure to the foot, I like to really solidify that hand at the bottom, cupping the heel or the ankle, just to let the client know that that is where the stable point is and that my hand is secure. It also allows you to manipulate the foot a little bit easier and to help give you a little more support as well when you're doing the techniques. Using the heel of your hand on some of these relaxation techniques not only covers a broader surface for your client, but it also helps your fingers by giving them a little break. You can see there all I'm doing is applying a little bit of pressure around the base of that big toe and around all of the bases of the toes. It's also a good area when you're working in reflexology to clear that eye, ear, and nose line. And I also like to focus a little bit on that shoulder reflex where you see the right thumb. Most people carry a lot of tension around there, and I like to dig in either in a circular fashion or hold and release, followed by some good long flowing strokes to help relax the client a little further. When you're switching from the left foot to the right foot, it's a good idea to keep contact with both feet. Keep one hand on one foot and then transition both hands onto the right foot, the foot that you'll be working on next. Again, apply a little bit of oil or lotion. You don't need a lot when working on the feet. Again, I like to work with that spinal reflex first, since that's usually an area that causes people the most complaints and problems. And don't be afraid to adjust the pressure as you need. If you need to use a little more pressure, that's fine. Just be sure to keep checking in with your client at all times. I like to spend a lot of time on the big toe, especially when doing the Reflexology for Balancing the Chakras program. The shoulder reflex found underneath of the little toe on the plantar side of the foot is often an area of a lot of tension and pain for the client, so don't be afraid to work over that area a few times as well as individually spending some time on the toes, just going over them, using your thumb and your forefinger, doing some gentle pulls, some gentle twists, whatever you feel is helping to let the client relax and to loosen up the area a little bit that you're working on. Pressing and holding on that shoulder reflex and working around the little toe is a great way to help your client relax. And you can always check in with them to see if that is affecting them, meaning if it is helping to relax them, if they're feeling tension in the shoulder while you're working on it. And it also is a good idea to work along that lateral side of the foot underneath of the pinky toe, as well as working up through the center of the foot all the way to the medial area or the spinal reflex found on the big toe side of the foot. Because the 6th and 7th chakra points in the feet are found on the big toe, make sure to spend plenty of time warming up that area and working on it between each chakra during the chakra treatment. I like to do some presses and holds on the brain area or the pineal gland area just to help the client not only relax a little bit, but it helps to stimulate those areas as well. And again, spend some time on each of the toes, between the toes. Remember that the toes reflect the sinuses in reflexology, so if your client is complaining of any kind of sinus pressure or congestion, it's a great idea to work these reflexes as well as incorporating into any relaxation technique during the chakra program. And again, do some of those heel slides, bracing the foot with each forearm as you're working each hand. It's also a good idea when you're working on the feet to work around that medial malleolus or ankle area to prepare the client for the second chakra work, followed by some good relaxation techniques up and along the foot. Doing some nice broad thumb strokes across the foot is very relaxing for your client, especially when working over that solar plex reflex. It's also good to acclimate your client to your touch on the top of the foot during some of these relaxation techniques. The top of the foot in reflexology is generally reserved for doing chest work or lymphatic drainage, but it's always a good idea to work the entire surface of the foot, both plantar and dorsal. When you're doing the relaxation techniques, you can also check in with your client not only for the amount of pressure being used, but also to see what feels good to them. Some clients prefer more gentle, broad strokes along the whole surface of the foot, while others prefer more detailed work and more thumb walking techniques. Again, doing a little gentle work over that reproductive area on this foot. We see the lateral side, and you don't want to use a lot of pressure when you're working around that area. And again, don't be afraid to check in with your client at any time to see if it is too much or if they would use a little more. Doing some knuckling on the plantar side of the foot like this really helps to make that client feel good. People love this technique. It's one of the most complimented techniques that I hear from my clients in their feedback. And again, you can adjust the pressure here. You can adjust which knuckles you're using to apply more pressure to, and kind of go by what you feel. In the areas that you've worked, you'll be able to tell what areas are more tense or need a little more work than others. And don't be afraid to go back and revisit these when you're doing just these relaxation techniques. This technique I like to do underneath of the pinky toe and slide all the way down that lateral edge of the foot, hooking the foot between the first finger and the second finger. It gives the client a very reassuring, nurturing kind of stroke that also creates a lot of relaxation. When you're getting ready to end the session, it's a good idea to do either some rotations or some larger, broader strokes. It kind of signals to the client that the treatment is concluding or that you're moving from one transition to another. So I like to work here around the ankles good, do some rotations clockwise and then some counterclockwise, helping the client relax fully using and engaging the entire leg. And when you're getting ready to end your treatment, you always want to close by unveiling both feet and bringing that sense of center back to the client. Again, some nice broad strokes here, some gentle holds, some gentle pulls. Give the client a couple nice stretches, turning the feet in towards each other and then rotating them out, back in and out a couple of times. And I always like to end my reflexology treatments with a nice hold on that solar plex area on both feet.